On the sidelines of the Health Diplomacy Seminar, I will be interviewing experts on their own experience in health diplomacy. I'm very glad to interview Dr. Stephen Morrison, Senior Vice President, Center for Strategic and International Studies in Washington, D.C., USA. Thank you so much, Dr. Morrison, for your time.
Thank you, Rana. It's a great pleasure to be here with you.
Thank you. Attacks on healthcare facilities have become, unfortunately, a trend in our region. How can health diplomacy contribute to stopping these violations?
Thank you. First, you're absolutely right. This is a terrible problem. We've seen a proliferation of attacks upon health providers and upon facilities and upon innocent civilians across multiple conflicts by all parties to these conflicts. It's a collapse of any respect for the neutrality of the health sector and other humanitarians, and it's a terrible problem. Over 700 health providers murdered in Syria, over 350 attacks upon health facilities. And that's just Syria. It's a problem we're seeing in Yemen, in Iraq, in Libya. So what's to be done? Well, this week, on May 3rd, Egypt and the presidency at the Security Council brought forward a very stern resolution detailing the problem, condemning the problem, calling for all parties to the conflict to cease, and calling for reporting back to the UN Secretary General on a yearly basis on these matters. And that passed unanimously, and it passed with the support from over 80 countries. So that was a significant move. We will see what difference it makes in changing the behavior in these conflicts of the parties that are attacking them. There has to be other measures taken also. There was the instance last October of the U.S. military striking an MSF hospital in Afghanistan, in Kunduz. I think it was 67 people were killed in that tragedy. There was an investigation just completed recently by the U.S. Department of Defense that showed where the mistakes were made. There are ongoing negotiations and discussions with MSF around improving those modalities so that these facilities, that there's no question exactly what they are and where they are, so that they are off target. They are protected. There are other measures that can be taken. There can be training, greater communications to try and build up stronger protections. The challenge through various forms of diplomacy, the challenge is to take away the threat of violence against the health sector, because that protection has collapsed, and it's a terrible problem right now, and it has greatly contributed to the erosion and collapse of health services in many parts.
Thank you so much.
Thank you.